You know, we're both loss survivors who lost our sons. You lost your son, Alec, on his 26th birthday, and my son, Brian, I lost him 4 months before he turned 26. When did Alex start struggling, and what was life like at that time for you and your family?
Karen, first, thank you so much for having me. And I'm so honored to know you. And I'm sorry that we know each other under these circumstances. And I'm so sorry that Brian is no longer here with us, but I know Alec and Brian are together, watching proudly over us right now at this moment. And Alec started struggling in his mid teens. He was diagnosed later in life with a mild form of bipolar disease. He also suffered from ADHD, which was misdiagnosed and not diagnosed, and then misdiagnosed, and depression. A highly intelligent individual, which also came with a highly sensitive individual. And there wasn't a lot that was known about mental health disease at that time. And there's still a lot not known about it.
Right.
But thankfully, we are talking about it a lot more. So there was a lot of stigma in just talking about mental health disease. And so he started off, he was an incredibly athletic, like I said, very highly sensitive kid. And he played hockey. He was a AAA hockey player, but he struggled with his emotions. And at one point, then he started self medicating, first with alcohol, then with marijuana, then with prescription pills that were so readily available at that time,
Right.
opioids. And then unfortunately that led down to a very dark path where he started using illicit substances that were highly addictive. And it was very, very difficult watching him go down that path. We felt inadequate as parents. We felt healthcare protocols were severely inadequate. And we all we could do was sort of chase our tail and trying to get him better.
Yeah, you say that as a mom, you were kind of at a loss chasing your tail, trying to figure out how to help him. And I felt exactly the same way about Brian. Can you share more about how that feels like as a parent?
Yeah, and it was with Alec, it was about a 7 year struggle of us chasing our tails, desperately trying to look for answers. There was no book. Medical providers didn't know much. They would prescribe ADHD medicines or various types of medications. Schools were not equipped. A
Right.
lot of them stigmatized Alec and thought he was just misbehaving. Perhaps we were just not parenting right. We questioned ourselves about that. And but I was so nervous because at the same time I was looking at the scourge of fentanyl. And I kept saying to my husband and to my mother-in-law and to other members in our family that we are up against time here. We've got to get Alec some help. We've got to get him on a permanent path to recovery before the fentanyl gets to him.
Right.
And ultimately, he passed away on his 26th birthday. And Karen, I got to tell you, and I don't know if this was the case for Brian. I'd love to learn, but Alec was doing the best he had actually in 7 years. And we were finally hopeful at the age of 25 that he would find that path to permanent
Right.
recovery. He wanted nothing more than to live a life of sobriety, empowered by the love of his friends and family. And on that day, on his 26th birthday, he always talked about two voices in his head. One that would say, "That's it, we're done, we're not doing this again," and another that would say, "One last time." And on his birthday, that voice got the better of him. And unfortunately, he was not allowed another time. And he did not want to die here. And he had Narcan right next to his bedside, in his car, on the table. It was surrounding him. And he lived in a sober living home. Um, where kids were right outside his room, but they didn't know that he relapsed. And the reason why they didn't know is because he was very ashamed every time he relapsed. And that was unfortunately, that shame is what brought him to doing this alone. His substance was laced with poison. He was poisoned to death.
Right. I'm so sorry, Dita. Um, my situation with Brian was very different. He was 25 years old, a big, tall, very intelligent too, very sensitive boy, young man, who was not yet diagnosed. And I felt powerless as a parent. I didn't know that there were resources like 211. There wasn't, adult mobile crisis at that time. 988 didn't exist at that time. And I knew he was suicidal, but he was not on a path to recovery, trying to blame any other physical ailment to explain why he was feeling the way he did, and did not want any help or support from me at the time. So I knew he was in trouble, and I had no idea how to help him. And I heard you mention something that you've said, and that's that Brian, not Brian, I'm sorry, that's hard, that Alec gave you, and this gives me hope, that Alec gave you kind of his blessing to share about his illness and to talk about his story. And he said some pretty powerful things in relation to that. Can you share that with us today?
100%. I feel very blessed that Alec left me with his rallying cry. And so at the time, uh, several weeks leading up to when he was poisoned by fentanyl, Alec and I had a conversation. I was actually running for statewide office in the state of Connecticut at that time. And I talked a lot about the addiction crisis, about the mental health crisis. And I asked Alec the question, listen, if the topic ever comes up about your struggles, how would you want me to talk about it? Do you want me to talk about it? And he answered my question with his own question, which was, would you ask me this if I had cancer? And that was like such an aha moment because I knew I was stigmatizing just by asking this question. He said, my friends have died and more are going to die. And I don't feel like anybody's really paying attention. They think it's our fault. They think it's our choice. We don't want to live this way. We have a disease and we just need the help. But people don't look at it that way. You need to talk about it. You need to talk about my friends. You need to talk about me. And you need to get legislators and public health leaders to do something about this.
Right.
And I feel so blessed that he left me with this because I'm not
Right.
sure how our family would have come out with his story had he not actually given me those marching orders. I got to tell you, Karen, we had one son, Alec, who struggled with substance use and mental health disorder. We have another child who was diagnosed with type 1 diabetes when he was 11. And the type of care that we had access to should not have been any different. One child, we
Mm.
struggled for 7 years and could not find the right solutions for him. The other, within a month, we knew exactly how to make his life as normal as possible. And he's doing everything he wants. And he's going to live, his full potential. And our other child should still be here doing the same thing. And so should hundreds of thousands of other children like Brian and others who did
Right.
not get the opportunity because we could not provide them with the right resources.
I hear you. Can you speak a little more about secrecy and stigma and how that exacerbates the current mental health crisis,
Yeah.
and addiction crisis in our country?
Yeah. Look, stigma to me has been and is still one of the biggest barriers to our loved ones being able to receive the type of healthcare they need and they deserve. I can't tell you how many, well, first of all, Alec alone was so ashamed. He was so ashamed to every time he relapsed. It would take him a while to let us know. It would take a while for him to let his friends know because that's the way society treated him. And unfortunately, you probably know this, Karen, but a large majority of healthcare workers stigmatize addiction and mental health disease. They don't get it because we're not educating them on it. So if we are not treating mental health and addiction diseases as an actual healthcare problem, which the Surgeon General has absolutely said this is. It's a wiring in the brain. We know this. It's chemistry. It's rewiring. It's actually a lot of it is much of our fault as a society by making drugs so regularly available, pharmaceuticals lying about the addictive nature of drugs, social media making it worse for our kids in terms of mental health, socioeconomic disparity, all of the structural nuances that have created this society where it's easy for people to suffer from mental health and addiction diseases, but then yet we blame them for these diseases instead of helping them. We need to erase those barriers of stigma and really find those evidence-based solutions and work together as communities to provide the type of support that should be given to anybody the same way it is for diabetes, the same way it is for cancer or any other disease. And the
Amen.
stigma is the difference.
Amen, Dita. Thank you for sharing that. Your life has changed a lot, from what I understand, both professionally and personally since Alec died. Can you share about that and why you feel compelled to tell your story and Alec's story?
Absolutely. So, yes, I was in finance for over 20 years. And as Alec was a teenager, uh, and I'd learned about his struggles, and we struggled as a family. And you know very well that mental health and addiction diseases becomes a family disease, right? It's not just your child or your loved one. It is something that the entire family lives through painfully, and often without any type of help. And I'm so glad that things are changing. I'm so grateful for the work that United Way of Connecticut is doing. I'm also a advisory board member for Shatterproof, and these organizations that are breaking those barriers of stigma, that are doing the 211 and having those the public learn and healthcare workers learn about these diseases so we can be more helpful. But when Alec was a teen, I started focusing much more on public policy, on the stigma, on what we need to do as big nonprofit organizations, and partner with communities, and partner with public health officials, and partner with legislators. And so I'd hosted a lot of roundtables with various organizations across the state of Connecticut, where we brought all sorts of stakeholders from many different levels and the public to try and have those conversations, those difficult conversations, and tell those stories to erase the stigma. And actually, this year, I have started my master's in public health
Oh,
at
congratulations.
Thank you. Yes, I started in July, and I feel so excited to learn all of the different, first of all, meet some great people, but learn more about epidemiology and how diseases work and what we can do, and actually find the best way that I can use my talents and my passion to make a difference in this domain.
That's wonderful. Congratulations on that. One last question for you, unless there's anything else you'd like to add, and that is, if you had one message to share with other parents, other moms like us, what would that message be? What's your call to action to them?
So, yes, that's a great question. And I felt very alone. Our family felt very alone, and I'm sure you did too, Karen, but it doesn't have to be that way. And there's a lot of resources now that families can tap into through United Way of Connecticut. I actually helped bring a program called Atlas into the state of Connecticut, which is a program that Shatterproof has put together, which is essentially a directory of treatment centers, which would have been so helpful for me
Right.
and our family at that time. So we need to collaborate more. And my message would be that you are not alone. Collaborate, find these programs, come out with your story, tell your loved one it's okay. We're not mad at you. We understand. We are going to get you help. This is a disease, and just like any other medication or any other disease, we're going to help you get better. And then find those resources that they're all over the place. And the more that we come out and talk about our loved ones, and families come out and talk about their stories, the more those break the barriers of stigma. So don't be shy about that. This is a disease, and we must come together to make sure that we get to the other side. And there's some great examples of this, like the AIDS epidemic, where those barriers can be broken, and we can really significantly eradicate the death toll and the devastation that these diseases are causing on our communities and our families and individuals.
Thank you for that. Thank you so much for sharing your story, your family story, Alex's story, your experience, your lived experience, I should say, right? And your hope for and solutions for what would make this situation better and how many more lives we might be able to save, especially our young people's lives. That percentage is increasing as we speak. You're so inspiring and so brave and courageous, and I thank you
Well,
for sharing.
and thank you. And thank you, United Way of Connecticut. And I just also want to say, look, I am optimistic because, over the last 4 years, 3.5 years, we've seen over $80 billion of investment from the federal government into addiction, for instance. There is a movement, and legislators and government is catching on. I'm very grateful for that, and we must build on this momentum and continue to make those investments, because at the end of the day, we need legislators, we need policymakers, and we need the money to make sure that we are focused on these diseases for good outcomes.
Here,
Thank you,
here.
Karen, so much.
Thank you very much.